Lots of people are really familiar with antihistamines. Antihistamines, I like to describe them as comfort medicine. They can make an itchy person less itchy. They can take care of mucosal and skin things really well. They can take the edge off of some abdominal pain sometimes too. They can provide comfort, but they're not going to shut an allergic reaction down. Antihistamines can take 30 to 60 minutes to start working. Remember, I said peak levels for epinephrine in 8 minutes. Antihistamines, 30 to 60 minutes. Dr. Gupta mentioned the diphenhydramine, Benadryl. This can come with sedation, with tiredness. And as we were talking about before, being able to assess mental status in somebody who may be having anaphylaxis is going to be really important. And in a baby, being able to tell if a kid is playful and interactive, that's very reassuring. If they have any of those changes in their crankiness, irritability, tiredness, that's going to be less reassuring. And if they had diphenhydramine, if they had Benadryl and they are now snoozing, how do we know? So this is where using a non-sedating antihistamine is going to be important, especially in an infant and a toddler. And so something like cetirizine, commonly known as Zyrtec, less sedating, but again, it is comfort medicine only, not meant to decrease the severity of an allergic reaction, meant to provide mucosal skin comfort.
So I have a question. When would you use an antihistamine when we're always talking about first line of defense is epinephrine?
Some people choose not to include an antihistamine like cetirizine on an action plan. The action plan is really helpful for a family to be able to pass along to someone else and to also guide themselves in when in this person's potential reaction are they going to use epinephrine, and when might they think about a secondary medication like cetirizine. Some allergists choose not to put an antihistamine on at all. I personally don't put an antihistamine on the action plans that I put together because I don't consider an antihistamine emergency medicine. When there's a potential emergency situation, epinephrine is the answer. But now, when that child no longer fulfills any potential criteria for anaphylaxis, if they were to have only mild skin limited symptoms, then comfort medicine makes sense.